All right. So today we're talking about the scientific basis of botanical medicines for pain. The objectives are to cover some of the mechanisms of action, indications, and contraindications of botanical approaches for pain and inflammation. And you might be familiar with some of these herbs, especially we're going to try to get to cannabis at the end. But whether these were in your Starbucks drink this morning or you go to bed with a lavender, little compress or anything, these are very familiar herbs, but still that doesn't mean that they're necessarily safe. And what we need to know are the mechanisms, the pharmacology, just like medications. And for sure, we know that our clients are accessing many of these. But again, if we can treat an animal with a composite of approaches, including acupuncture, massage, laser, and all that. But from a botanical repertoire, if we can address when needed their psyche, so relaxing them, and also addressing, the type of pain that they're having. Is it inflammatory pain? Is it myofascial? Is it abdominal? Is it GI? So we'll see that, for example, something like peppermint has quite a bit of research for GI pain. Now, this is mainly for humans, as we know, but a lot of the basic science work has been done, of course, in rodents. But there are ways that we can extrapolate, or at least we could understand the basics and begin to apply them to animals, like we're seeing with cannabis. So, our next webinar will be on the pharmacology of cannabis. So, I'm going to reserve uh, a lot of that discussion for next time. But where can you find factual information? Here's one place, but as a resource in your day-to-day treatment of patients, I want you to definitely know about two main areas that you can search for factual information. Again, it's targeted for the human profession, but we really don't have anything for the veterinary. And as we've talked about in our private Facebook group for the medical acupuncture for veterinarians course, humans are animals and they're mammals and the primate type, but there's a lot we can extrapolate and consider how animals were before, Park Davis became a thing. Um, you know, because of the field of zoopharmacognosy, they themselves would find medicinal plants in nature. So it's very natural for them to access plant compounds for healing. But this About Herbs app is key for you. And it's produced by the Memorial Sloan Kettering Cancer Center. It's a free download. And you can look at it on your iPad, as you see here, or your phone. They also have a web resource. And and they don't have a fully exhaustive herbs listing. And this is actually from the website. This is a screenshot, and and you see it's alphabetical. Now they do start with 5-hydroxytryptophan, which is not an herb per se. They do have a few supplements put in there, but this is a way you can take get this web page up and even put in the search bar here what you're interested in searching for. Now, the other resource that is key, and we'll do a little exercise with this with peppermint later on, is pubmed.gov. This is my go-to resource for whatever I am looking at, whether it's the dreaded TPLO, or if it's Boswellia, or if it's peppermint, or if it's acupuncture pain, or whatever. So you just put in this search bar your term. So if I wanted to know, okay, well, I have a client that's giving a product that has mainly Boswellia in it, I can look on the About Herbs app, or I can also search on PubMed.gov, because whatever is going to be updated in your About Herbs app, I mean, that's going to have to come from research, and this is where research is produced, published. So, and as we'll reiterate this later, but PubMed.gov, and they do have a new type of web page format. But notice here on this left side under text availability, free full text. So this is your opportunity to go online shopping without taking your credit card out and keeping yourself nice and busy and your brain nice and active and happier than maybe it's been past few weeks, and find great information that is thrilling to see. So here, right off the bat, we have adverse effects of herbal medicine. It's an overview of systematic reviews that we'll be discussing Boswellia and so on. So this free PMC article means it's free for download. So you have a lot of access to information, and you should not have to rely on mystical processes, liver wind, heat, and undisclosed herbs and all this stuff. We can approach botanical medicine scientifically, and we should. So, which herbs are appropriate for which individuals? Before prescribing synthetic or plant based drugs, of course, what should we know? Not, what's the color of their tongue or what's their Chinese medicine pulse, because that's not going to give us anything reliable. What we need to know is the main problem or the diagnosis to the degree possible based on our myofascial exam and our general evaluation of the patient. But that's not all. We can't say, oh, cat has IBD or dog has neck pain. Let's just give some curcumin or whatever, which is the active constituent in turmeric. We need to know the comorbidities. So when you look into your About Herbs database and all that wealth of knowledge that's packed in there, then you will see sometimes there are going to be contraindications. So let's say there were gallbladder problems, that's going to contraindicate certain herbs. So we need to know what that patient is. You can't just as you shouldn't be prescribing drugs telemedicine wise without knowing who that individual is and what's going on with them. We shouldn't be doing that with herbs either. So all these things are important, not only the comorbidities, but what are they intolerant of? So we need to know, like, what are the ingredients in that supplement or product? What's the ease of administration? Thinking cats or lizards or whoever. The frequency of dosing, because sometimes with botanical products, you need to have it dosed a bit more often than with pharmaceuticals. Xenobiotic interaction. So a xenobiotic is just something that is coming out, it's coming foreign to the system. And so interactions are a huge thing. And even veterinary students in school don't seem to know, because I've talked to vet students about this, they don't seem to know enough about the P450 system, cytochrome P450. So how drugs are detoxified, the P glycoprotein pathway, and so on. So that becomes really relevant not only in regular medicine, but also in botanical medicine. So, what happens when a plant becomes a medicine? Well, that's another thing that we need to be cognizant of. I always think of carprofen for something like this. So, what are we looking for in carprofen? Yeah, it's usually carprofen, synthesized in a lab. It's going to have consistent content, probably. It's going to be free of contaminants, probably, and have a predictable outcome. Um, there's still going to be issues with what other drugs are they on, what are their comorbidities, and so on. But why I say these maybes or probablys are because contamination, adulteration, all that, but more contaminated or counterfeit products is becoming more of a thing with drugs, especially those imported from Asia. And in our herbal certification course for botanical medicine consulting, um, I do ask people a question about which drugs in your pharmacy currently are are imported, and it's an interesting range of information I have. But because they've done some work previously, doing some reading, then if they've been paying attention, they know. Well, I can't tell because each drug may have constituents that were imported from Asia. And as such, those constituents, which can be really hard to track, and often the FDA doesn't even know all the different places that a given drug's components are from, then there could be a problem with certain components that were imported from Asia that you're not going to track down from your pharmaceutical supplier, or it's not going to be on the label. So thinking about a quintessential botanical like cannabis, but it could be any of these things that we're talking about. It's just a plant. They're made of many chemicals. Yeah, they're natural, but what does that mean? So they're natural growing somewhere. looking at the sun every day and dealing with bugs, but their chemistry is going to differ based on how they were grown and what they were grown in. And in our cannabis course, I have quite a bit on the effects of the environment on a plant's components, and especially when you are a bioaccumulator like cannabis is, that means you're really good at taking stuff out of the soil. Well, that means if you're a ginger root, you've been sucking in all kinds of cadmium and other things if you're next to that big paint factory in China or elsewhere. It could be in Texas. So where are these plants grown? It brings us up to considerations also of one, health, so that human, animal, and planetary health all interrelate. I think we're starting to see some of that more and more. So then they may contain toxins, but there's a bunch of different active chemicals that are in plants, and that's what can make it challenging. Is that what um, what is the chemical makeup of one plant versus another, depending on if fertilizer was used when it was harvested, etc. So lots of things to consider. It's more than just the bottle of carprofen, but it's an exuberant way to practice, because if you pursue it scientifically, there's so much interesting stuff that comes up. Um, so yeah, of late there have been just over-the-counter medications or blood pressure medications, different things that have been shown to have contaminants. And so you think that everything's okay when really it's not. So, general effects of analgesic herbs, it's also another thing, because the beauty of the polypharmacy inherent in a plant is that you can have multiple mechanisms of action. It's not just, oh, I'm going to inhibit these inflammatory pathways or this specific one. It's, again, like many different herbs fill this, but cannabis is a nice one as an example. Has anti-inflammatory effects, neuroprotective, is anti-nociceptive, anxiolytic, vasorelaxant, and antioxidant, all those being important for proper pain control. And then another facet of this is that um, when you get into the anti-inflammatory piece and the natural, countering of that, it's like we're so programmed into thinking NSAIDs. Is that really right or wrong? So a newer way to think about treating an inflamed part of a patient or total patient is on accentuating the intrinsic re- resolution mechanisms of inflammation within that patient. So, yeah, not only be positive, take it easy, and all that, but the natural resolution of inflammation. So, and again, you could find this online very easily, periodontology back in 2000. So, this has been around for about 20 years, but not thinking that we just shut inflammation down and we're done with it, but really, how do we help augment the body's own resolutions of inflammation, its capacity to be done with it, which is actually quite complex. And as I say here, we now understand that the natural resolution of inflammation involves well integrated, active biochemical programs that return tissues to homeostasis. So, coming from my osteopathic background, I love just doing this. I love thinking of all the different ways that the body um, helps protect itself, helps to recover, helps to restore homeostasis. And so getting into the physiology of resolution of inflammation is really a fun thing. And that's part of how the omega-3 fatty acids work as well. So again, for example, here's a paper. I don't know that this was free for download, but anti-inflammatory drugs and herbs with special emphasis on countering inflammatory disease. So there's lots of things, lots of information out there that you can access. So breaking down and reviewing that inflammatory pathway and all the different mediators, and we can think of all the different ways from a prima practitioner standpoint, the pain rehabilitation and integrative medicine advantage. Okay, so the full spectrum, a prima practitioner that has acupuncture and photomedicine and massage, all that can be brought to bear for anti-inflammatory effects. And so here, Inflammation 2010, New Adventures of an Old Flame. How can um, we thinking of laser even immediately, we shift the phenotype with the macrophages from releasing pro-inflammatory mediators and that state to an anti-inflammatory release. So just even the macrophages we can influence. So new therapeutic frontier, and when we do find plant products that work in this way, then we're not relying on a medication that is, quotes, resolution toxic. When we apply um, these anti-inflammatories, so nonsteroidals in general, then we are impacting the mechanisms that will assist the body in fully getting rid of the inflammation. So um, when we when we have an insult, when we have an injury, then how does that go away? So you had a mosquito bite or you hit your thumb on something. It's not just that if you don't treat it, that the inflammation just goes away and dissolves. There are a series of, after the pro-inflammatory stage, that the body is actively resolving that inflammation. They're eliminating those white blood cells and eosinophils through systemic recirculation. Again, just thinking massage, laser, and then we'll talk about some herbs. Through local cell death, phagocytosis by monocyte-derived macrophages, they're going to clean things up and then eliminating those macrophages through lymphatic drainage or local apoptosis. And then the tissue can revert back to its non-inflammatory phenotype. So there is all this complexity. What we want is to lessen the inflammation and activate these programs that facilitate resolution. Glucocorticoids, interestingly, of course, we have our own type of glucocorticoids that we produce, has both anti-inflammatory properties and also stimulates resolution by activating macrophages. So they're not all that horrible. Here's another thing originally derived from plants. Aspirin spares or enhances resolution by generating versions of lipid mediators such as lipoxins and epimeric versions of resolvins and protectants. So those resolvins and protectants are really key. Those are derived from your omega-3 fatty acids. So, when we'll be talking about certain anti-inflammatory herbs like boswellia and curcumin, that those accentuate that the body's ability to resolve the inflammation, and they also have some intrinsic anti-inflammatory properties. So, getting back to plants in general, because this is just sort of an overview approach, we have to consider that plants have both toxic and non-toxic constituents. So, just being smart about it is all. So when we are excited about the opportunities that plants give us to heal that aren't available necessarily with the typical drugs that we use, we still need to have our thinking caps on and talk about contents and the quality of those contents, how they work, what's going to interact with them, what are the potential benefits and risks. It'd be nice to think about the environmental impact as well as how long are we going to use them and where can we access that scientific information. So we've already talked about some of that. So herbs for pain. Now this isn't one on our list, but thinking critically, some of you may have heard about comfrey. And you'll see here a salve on the left or some comfrey oil here. Here's the actual plant that I used to have growing abundantly in my yard. Fortunately, my cats never were interested in it. But one of my human patients, when after I started vet school, I was seeing humans both in Boulder, but also in my house in Fort Collins. And one of my patients gave me this pretty plant that had these pretty little fairy type flowers on it. I didn't know what it was, and she had a different name for it. So I thought, wow, and it grew really well here in Colorado. Um, and then over the years, I found out what it was because I was treating a poisonous plants expert in my practice, and he told me, he said, you shouldn't have that in your yard with animals. But anyway, so on WebMD, if we looked at that and we thought about pain, again, thinking critically on all this, if you have lower or upper back pain, you could try a skin cream made with comfrey extract. Use it 3 times a day. Make sure you've seen a doctor first to get it diagnosed. Oh yeah, back pain has many causes. Some can be life-threatening. Yeah, can harm your liver if you take it by mouth. So don't drink comfrey tea. Okay, but as veterinarians, we know better. So you can even find in some of the holistic, and I use that word in the sense of how it used to be, like, oh, everything's wonderful if it's not, synthetic. But anyway, they would advocate at using comfrey for cancer, for pain, for broken bones, etc. And although the FDA said, you shouldn't really be using comfrey in animals, they're like, don't worry about that. That's overblown. It's fine. Um, so here from Healthline.com, which is another health resource site, talking about comfrey, the roots and leaves of the comfrey plant have been used in traditional medicine in many parts of the world. It's been used for over 2,000 years. So some people might say, oh, well, must be good if it's used that long. Originally called knit bone because people would use it for broken bones and also other musculoskeletal ailments. So if you just read that, it's like comfrey's pretty cool. But it's not, especially when you're going to take it internally and most animals can lick it, and especially too if you were going to be using it over a long period of time. This compound that I question, some of you know because some of you have been students of mine in school, but what is that compound that's not only in comfrey but is also in chaparral that can injure the liver and cause cancer, which some holistic providers say, don't worry about that. Begins with a P, pyrrolizidine alkaloids. Okay. And with comfrey, it can cause hepatic veno-occlusive disease, possibly cancer. But they come in these really pretty bottles, sometimes with other flowers on them. Further information why it is bad, and this is from 2018, metabolism, genotoxicity, and carcinogenicity of comfrey. So this is just to reinforce to you why you need to know the science of these things. You can't go with folkloric recommendations, even something like WebMD or Healthline. They're not going into what I think you should know if you were going to be using herbs. Now, comfrey over time has been used as large animal feed. If you saw it in my yard, you could feed a horse on that. And but yet it produces hepatotoxicity in them and carcinogenicity in experimental animals. And there are as many as 14 pyrrolizidine alkaloids in there. So, eh, you got other options, right? Cannabis is a much better option. Mutagenic in the liver, and they accumulate. So if you're going to be doing this over time, you're going to get worse and worse problems. So this is a screenshot just to educate you. What I want to do is empower you to know that there is a scientific way to approach this. Number one, that you have resources, so about herbs and PubMed.gov, and you can always be updating yourself because that's the thing, especially with herbs. So much is coming out that will build our knowledge that much more richly. So you go to about herbs. This is from their website, and you'll see here that you'll see these other names that have been commonly used, which is another problem with herbal medicine, is that for the folkloric names, there there have been many. So you can, it's really best to know the species name. So you'll see here, though, for patients and caregivers or for healthcare professionals, and I had clicked for patients and caregivers. So that gives the reader a more common language rundown of all the stuff that they're going to say about the herb. If you clicked on healthcare professionals, which you would do, but you'd guide your clients to patients and caregivers, um, oops, then you'd see more of the sciencey stuff. But here, just right here, comfrey has not been shown to treat or prevent cancer, several cases of liver toxicity. So, bottom line, don't use it in veterinary patients, but I hope that this provided you an illustration of the things that we should be on the lookout for and why we need to approach these as drugs. Then there's herb drug interactions. I had mentioned the outset St. John's wort, which this is, and that's your answer. Which herb interacts with many drugs and reduces their effectiveness? And so, before we go on to the entourage effect, the the issue with this, I mean, if you're, it's like, okay, if you have, I'll go back to that slide, you have a plant like St. John's wort, which is going to, for the most part, induce cytochrome P450 enzymes, which are drug metabolizing, detoxifying enzymes designed to protect your body from these xenobiotics, xenobiotics, um, then you're inducing the enzymes. So for those drugs that are going to be metabolized by that same family of cytochrome P450 enzymes, then you're going to reduce dramatically the circulating concentration of those co-administered medications. So think about that if you were giving chemotherapy, if you were giving pain medications, if you're giving anti-epileptic medications, if you're giving anesthetic drugs, really crucial. So I feel like, no veterinarian should graduate from school not knowing something like that, something as basic as that. And then just the multiplicity of things to think about with cannabis. The name, the entourage effect, has become popular, but that applies to anything. Even with St. John's wort, there's not just one chemical in there that we're thinking about. There's a whole slew of them. So that's the beauty and complexity of plant-based medicine and why it's so hard, but why it's so fun. And here in Pharmacy Times is an example back from 2018 of how a female of childbearing age that is taking oral contraceptives and St. John's wort could become pregnant and become confused on why that happened. But it's that eating up of the co-administered drugs that St. John's wort can do that um, be too easy to say could get you into trouble, but I guess I will. All right. So, but nonetheless, from a mind pain, from an emotional pain perspective, yes, St. John's wort can help relieve depression. It can also reduce neuropathic pain. So that's another big key for St. John's wort, but you just use it rationally now that you know of it. Um, so anyway, the active constituents among its own entourage are hypericin and hyperforin, but those are the ones that can interact with chemicals. So it's like those are the good things, but those are also what will interact. It also has neuroprotective effects. So there we go, having a multiplicity of mechanisms. That's really fun and beneficial. Okay, so bottom line, be prepared. Now, if you're in a clinic or if you had animals and you were going to use some botanical drugs for pain and inflammation, they go to surgery. What do you have to be thinking of? Well, let's think of this case. The client's been giving her golden retriever a mixture of, in addition to St. John's wort maybe, but anyways, ginger, garlic, ginseng, and ginkgo. Remember for spelling, because if you take my herb course, I'm going to grade you on that. K before G, ginkgo. Taken this mixture of capsules for about a year. Now the dog needs a splenectomy for suspected hemangiosarcoma. What could go wrong? Just a natural product. Well, and he might even, throw in some white willow bark. But sure, ginger has benefits. So think about what could go wrong. But here's some benefits. So maybe they're eating some bark wheats too. Ginger and parsley flavor for all these nice things. Was anti-carcinogenic. Unfortunately, didn't work in this dog's case because she got cancer. But another thing to think about while you're thinking about the interaction problem for anesthesia, hypoglycemic. Lots of plant products are hypoglycemia inducing. Think of cinnamon for one. Think of ginseng is another, but ginger also. So everything has like all these tentacles that go to other things. So if you had a tightly controlled diabetic, which I think is not as common in veterinary medicine as human, but how are we going to be messing with their blood sugar? Are they going to have a hypoglycemic episode when they've already been tolerating insulin well when you started these anti-diabetic herbs? And if you have somebody, whether it's a veterinarian that doesn't know any better, or a folkloric human practitioner or something, and they're like, "Oh, ginger's anti-diabetic. Let's give this to this animal." Yeah, well, there are things you got to think about here. It's a really nice anti-diarrheal, though, and you often see ginger included in digestive system products because it inhibits enterotoxin-induced fluid secretion in the ileum. It's just really, really good. If you ever I like to think of this scenario if you were on a date and just you went for an Indian meal or something and you just didn't start to feel so good. If you could get some candied ginger or even a chai or something, it's going to help you a bunch. So note to self on that one. Counteracts abnormal facilitation of GI motility, works with the TRP channel, so works with your enteric nervous system. Ginger is a beautiful product and has been around so long. It's one of the first plant products used medicinally and even here, so just back to what is the interaction that could be negative for you prior to surgery. Keep thinking of that because here that old um you know golden retriever was probably osteoarthritic. And so here, efficacy and safety of ginger in osteoarthritis patients, a meta-analysis of randomized placebo-controlled trials. Recommendations from the American College of Rheumatology for OA, we're thinking of drugs, but there are problems. And so here, a meta-analysis on ginger for osteoarthritis demonstrated that ginger has a superior effect on osteoarthritis, pain, and disability compared to placebo and without serious adverse effects. Something to consider. Who's recommending ginger for problems? Um, so, however, herb-drug interaction, something you should consider even with these wonderful herbs. NSAIDs, ginger may increase bleeding tendency with concomitant use of drugs such as diclofenac or ibuprofen. And here's another way that you can get risk of bleeding is it can inhibit thromboxane formation and platelet aggregation. So that's the thing. The 4 herbs, ginger, ginkgo, ginseng, and garlic, which are all from the wonderful Chinese medicine repertoire, have been used thousands of years, all these things. But it's like, okay, nowadays, let's be real. Let's think about the interactions. And then we've also talked about the hypoglycemia aspects. Tacrolimus, pretreatment with ginger increases plasma levels of tacrolimus. Cyclosporin, concomitant use with ginger decreases blood concentrations of cyclosporin. Stuff you might not even think about. Or you take my course or somebody else's or whatever, and it's like, well, I didn't hear about that. Well, you should be looking on your About Herbs app and your PubMed.gov for updated information. So be prepared for herb-drug interactions when using any herb. Okay, so I've told you the 4 Gs. What's that? Right, ginger. That one? Ginkgo, I heard you say that. K before G. Manly herb, looks like little men, lots of tentacles there. Ginseng. You know that one. I'm not going to tell you. Oops, got it already there. What about that one? What's the names? You've probably seen this more in the grocery stores. Yep, turmeric. Okay, so one favorite thing I've heard from people in the rehab field is sprinkle turmeric on your dog's food every day. Make them eat it because they'll eat it because some eat anything. But where's your turmeric from? So even turmeric that's been available in the US can be lead laden. These brands had been recalled back in 2016. So even in the US, ground turmeric as a source of lead exposure in the US 2017 report. And so ideally you would get a compound that is safe, but really sprinkling a little bit of turmeric on a dog's food every day, that maybe there'll be a cumulative benefit. There's a lot to consider there. If you really wanted the anti-inflammatory effects from turmeric, you should be giving curcumin, and likely in a capsule. You may have run across this, your clients, or you have been making golden paste. Well, turmeric golden paste, it's not the same everywhere. So look at 2 different formulations. Coconut oil is the same. Then this one on the left has cinnamon, Himalayan salt, and black pepper. This one on the right has maple syrup, cinnamon, turmeric, spice. Getting hungry. But they're different. So, and here, Doug English, vet. So you see here, peppercorns, okay, that's good. Healthy fat, all right. Turmeric and water. So there's not even any, well, who knows what oil that is. So why these products are in there? Especially, why add black pepper? Because that's important. Now here, this is all the way back from 1998. Influence of piperine on the pharmacokinetics of curcumin in animals and human volunteers. Piperine from black pepper. So read here, in humans, after a dose of 2 grams of curcumin alone, so curcumin is the active constituent in turmeric that is present at 2 to 3% of turmeric. So given 2 grams of that, after you just do that, the levels were undetectable or very low. But if you added this ingredient from black pepper, the increase in bioavailability was 2,000%. Okay. So the study shows that in the dosages used, piperine enhances the serum concentration, the extent of absorption and bioavailability of curcumin in both rats and humans with no adverse effects. That's why you combine them. Okay, this one's pretty cool. The efficacy and safety of Curcuma domestica, so going for the species name, um, so extracts thereof of turmeric, compared with ibuprofen in patients with knee osteoarthritis, a multi-center study. So this is, and I see a question from Sarah, so thank you for that. We'll cover that at the end. Um, so just to still have critics. So this is okay. I'll show you this. This is back from 2014. So they wanted to see how turmeric extracts worked for patients with osteoarthritis, and you can see here that these. So it's knee pain. Okay, well, why didn't you just cut their tibia apart and paste it together and give them a TPL? Sorry. Okay, so patients with osteoarthritis of the knee with a pain score of 5 or higher got 1,200 milligrams per day of ibuprofen or turmeric extract, 1,500 milligrams per day for 4 weeks. So just even looking at that, there's a teeny bit of a red flag that comes up because if you wanted to know, okay, so what was that curcuma domestica extract? How strong was it? 1,500 milligrams of what? This is what we're dealing with the hemp products that we see. Oh, give X amount of hemp extract. Okay, right. We want to know about the entourage effect, but you're saying hemp extract? That's just nonsensical. But anyways, this is fun to be happy about. There was no difference in drug compliance between the groups that took essentially Advil or turmeric extract, and then I think they used tramadol for rescue groups, but there was essentially no significant difference between those two. The patient's global assessment and satisfaction at week 4 also was no different between groups, and most subjects were satisfied with the treatment. But I mean, how long can you be taking ibuprofen versus turmeric extract? So, oh, this is a good probably yours now, Sarah, because it's timely. I have heard that piperine, black pepper, taken with turmeric can cause leaky gut, inducing holes in the GI tract. I have not heard anything about that. I'd be curious about the mechanism. So that could be something that maybe you could email me, narda@curacore.org, or I'd be interested in hearing more about that, but I have not heard about that. Like, how much black pepper would you have to take, and how much turmeric extract? It's like we have, I cook with that. I mean, anyways, good point if that's out there. But if it is out there, we should find out the facts. I have not run across that concept, but thank you for asking me. Okay, so answered. We'll see what happens with that. Okay. Well, all right. Oh, all right. Oh, good. You've tried to find something cool. I've heard about it from Dave Asprey. All right. Well, we can cover that maybe in a future webinar. Circle back to that. Anyway, so the mechanisms of action, the anti-inflammatory effects of curcumin are shown that it does inhibit many different substances that play a role in inflammation. So there is that anti-inflammatory effect. They're not mentioning per se resolution aspects, but further issues with modifying the tissue matrix and the tissue milieu here. So the side effects mainly GI, so not super huge, but still keeping an eye on interactions and all that we have to think about. This is a pretty old slide that I got from an article quite a while ago, but just looking at all the various medical applications of an anti-inflammatory, really nice product like curcumin, but still wondering what's the best chemical formulation for that will make the most difference. But you can see all these different problems in humans that have been uh, studied, and all these numbers about the human trial. So it's really been looked at a lot, and this is an older one from 2010, raising the concept that if we can combine herbs with medication, especially something like chemo, we could conceivably, by potentiating anti-tumor effects like curcumin can do, then can we reduce the amounts of harmful chemotherapy drugs that we give? Okay, so wonderful drug. Let's use it all the time. Well, wait, herb drug interactions. Okay. I think this was from About Herbs. Okay, well, any of these anti-inflammatory herbs pretty much will be coagulation or antiplatelet. So there's that. Do you see any others that are interesting? Oh, doxorubicin inhibits doxorubicin-induced apoptosis of breast cell cancer lines in vitro. Clinical relevance not known. So whenever there's an interaction, we do have to ask: is it clinically relevant? Was it only shown in vitro? Have there been any in vivo reports? Um, Cyclophosphamide, dietary turmeric inhibits cyclophosphamide-induced tumor regression in animal studies. Amphotericin B. Here's the different cytochrome P450 enzymes. So the P450 enzyme, CYP, they each have families. And so let's say, there's this family of enzymes, there's this family of enzymes. If curcumin, let's say, inhibits cytochrome 3A4, that's a very commonly used substrate for detoxifying drugs. Like a lot of drugs come through that family of enzymes and get, degraded. So if curcumin is going to inhibit cytochrome 3A4, that could have very wide-ranging effects. Maybe short-term use did not result in clinically relevant interactions, but you see here, there are different families of enzymes that are also affected. Something to be considering. Not to say don't use it, but just be wary. You're using active plant drugs. Then we have the intestinal P-glycoprotein pathways. That's another drug dealing thing where the P-glycoprotein pathway is going to, once something gets into a cell, it's just going to escort it back out, say see you later, because it's protecting the body. So if you're going to inhibit that pump of getting rid of xenobiotics, then you can accumulate more concentrations of active chemicals within the system. So you're still messing with plasma concentrations. Anyway, here's another kind of thing that could come up as you search in your About Herbs with interactions, herb lab interactions. So sometimes there will be changes in assays due to what that herb is doing. Just like biotin, if you're going to take a lot of biotin for your hair and nails and skin, that can give you falsely low thyroid levels. Okay, bottom line, curcumin is effective but poorly bioavailable. Add piperine. We're waiting to hear about intestinal things, but watch for herb drug interactions. And then effect on the planet. Of course, in history, again, this was before Parke-Davis and Roche and everything. So people and animals got their drugs or whatever from the earth. But now that there's been interest in these plant compounds, some stuff has been over harvested, like Boswellia, which, and you see here in the bottom area, that's little frankincense oleoresin gums that you can burn, and that's your frankincense. Boswellia is a very nice herbal product for inflammation and pain. Has anti-inflammatory effects, also has resolving type of things going on. More and more has been known. It's modifying, these cytokines, and yet it does not have as strong analgesic effects as the anti-inflammatory aspects. So been sold as extracts and aromatherapy, but frankincense is in peril. I mean, we're all in peril too, actually. But frankincense goes from being in peril to facing extinction. That's 2019, because they're just growing cows instead of plants. This is from South Africa, and it's overgrazing and over harvesting. So it might not be available in the future. It's also been used for inflammatory bowel disease. So that's another sad thing that it behooves us to be conscientious about, and proactive in the way that we can, if we can be. Of course, then there's capsaicin, which you will find in some internally used mixtures. and but oftentimes externally used. The thought being that it's working through a number of different channels, and also releasing substance P. Maybe it's depleting it, so you're getting a loss of nociceptive capacity from those unmyelinated C fibers. And maybe in a prolonged fashion, capsaicin will lead to desensitization of neurons. But I mean, another aspect of capsaicin is it does have some antimicrobial properties. So, in used in tiny bits in formulae, I know there's one cannabis product that has it, especially for its effects on the trip channels. That I mean, it's like you eat some hot sauce. So that's you're taking in some capsaicin. So it has some good effects. It can have some analgesic effects in the gut unless you're doing it too much. So cat's claw and devil's claw. Cat's claw is on the top here, and devil's claw, that's pretty nasty stuff. But we're using the root of these, and so again, inhibiting certain inflammatory pathways. And they don't often talk just outrightly in many of these studies about the resolving part because that just hasn't been in the consciousness of a lot of these research, um, you know, investigators and things. So they might be just looking, okay, what can we compare to an NSAID? Okay, this, but again, the multiplicity of mechanisms is astounding for these plant products. Peppermint is very interesting, and this is just an exercise that you could try to get your typing fingers wet with doing your own kind of search, because really you should know how to do this. Every vet student that graduates should know how to do this, and yet it seems like, oh wow. I never figured out Google Scholar. Maybe I'm too old, but I really like this way to do it. So we're going to drop pubmed.gov and search for peppermint and pain, and then see what you find. So I've already done this just because it would be weird to do it right now. Okay, so you go to pubmed.gov and peppermint and pain. And what did I get? Okay, 115 articles on peppermint and pain. Okay, here's one. You can tell I clicked on it because that's purple now. And so, dietary and pharmacologic treatment of abdominal pain in irritable bowel syndrome. And then here's one review article: the physiologic effects and safety of peppermint oil and its efficacy in irritable bowel syndrome and other functional disorders. So, things to note on this. So, nice review article, and it says free PMC article. So, that's your online shopping. And as we look here, free full text, that's where, as I've said before, you can get stuff delivered to your desktop or wherever for free. And from this second article, The Physiologic Effects, look at this: several mechanisms of action. So, reinforcing these big concepts about herb, several mechanisms of action, including smooth muscle relaxation. So, that's going to address in the human, especially some animals may get irritable bowel syndrome as well. It's not inflammatory bowel syndrome, it's different. But with irritable bowel syndrome, you get this cramping and just messed up transit, visceral hypersensitivity. It's affecting that. It's got antimicrobial effects, as does ginger, as does cayenne, as do so many herbs. And that's why they were used originally in seasoning and in cooking. Has anti-inflammatory activity. Peppermint's effects are anti-inflammatory, whether they're in your gut and smooth muscle or whether they're on your skeletal muscle. It's really fun. That's why you see it in these menthol compounds used externally for so long. Modulation of psychosocial distress. Okay, and then all these things affects all your enteric physiologies. It's been used to help relax sphincters. So when you're doing a colonoscopy or some kind of endoscopy, if that endoscopist uses a little bit of peppermint oil, it can help relax that intestinal area and help facilitate passage of that scope. So you see here all its wonderment. Why aren't we learning about that in school? Um, just some other things, and we can think about, just like with cannabis, and again, next time we'll talk about cannabis, but the essence of peppermint treating pain and anxiety caused by intravenous catheterization in cardiac patients, a randomized controlled trial. This is using peppermint in an aromatherapy way. And of course, yeah, dogs have these big old olfactory bulbs and everything, but so we decreased the dose rate. But look, it attenuated the pain and anxiety caused by intravenous catheterization. Imagine that. You go to the hospital, maybe not right now, but you know, and it's like somebody gives you some peppermint to smell. How about that? And here's another different type of dispensing mechanism. Intranasal peppermint oil, just a little bit, or just even again, smelling that you thought you were going to have a migraine when you're getting an IV for your cardiac problem. And then, oh, you use that peppermint and it helped to anesthetize some of your trigeminal neurons in your head that could help abort the CNS response, you know, of what happens when you're going to get a migraine. So you don't have to have lidocaine. You can inhale peppermint, and here, as it says, probable mechanism. Um, reaching these internal spaces of the nose. You got these branches. Well, peppermint is also going to, like lidocaine, help to cut down that nerve activation that then triggers your whole migraine situation. And then this was back from 2013, but looking at some of the channels by which peppermint produces its menthol-induced analgesia. So again, so much stuff to learn and find and reinforce what you know about drugs, but see even better how many, how the multiplicity of mechanisms are with all these prima approaches, but here botanicals. So lavender has been used since ancient times. It was used for burns, has soothing effects and antimicrobial effects externally. Is generally recognized as safe. These are your little pockets of lavender essential oil on the leaves. And when we look at, so there's a sessile secretory gland, and there are non-secretory trichomes. So we'll be learning about the trichomes again for cannabis, and what they secrete in cannabis. But these chemicals in the plants are packaged really nicely and beautifully, and also lavender has this anxiolytic aspect, um, GABAergic, and also dose-related binding to glutamate. So glutamate is a big excitatory neurotransmitter. So here we're taking that down, improving sleep, relieving intestinal pain. We saw that also with peppermint, and somewhat with boswellia, but that's more inflammation. Restoring normal intestinal activity and offers some antimicrobial activity. Now, why don't we know about that? Um, so your education, as you probably know, I mean, especially the grads that are on the list here, um, you know that there's so much more to learn than is currently being taught, and that's why we, have this new program in Prima, so that you can practice with a multimodal flexibility and use these much less worrisome approaches for a large range of conditions. The anti-androgenic effect of lavender was from one study, and there were some teenage boys and they grew breasts, but who knows how much lavender they had. It's not going to be relevant for your dogs or your cats or you. Um, Interactions, could it be additive with sedatives or anesthetics? How much are they using? So just, it's been around. You see it again in the dog biscuits. So again, drugs versus what's this? Cannabis. Okay, so we'll go into cannabis much more in the next webinar, but just as to tantalize you a little bit, we'll start this. So what is cannabis? What can it treat that we know about? How does it work? Cannabis has gone by a lot of names. Marijuana, hemp, is it legal or illegal? Is it a medicinal, or is it an herb? It's a medicinal herb. Um, but anyway, yeah, cannabis covers the whole species. When we talk about hemp, so hemp grown agriculturally, these scrawny, stocky plants. I mentioned earlier on that cannabis is a bioaccumulator, and plants like hemp have been used to detoxify environments. So we still have to think about where these are grown if they are grown outside. And this farm bill that we have, where it says that you want to have, or that it's legal more or less, not really endorsed by any vet board yet. But anyway, if it's grown as hemp, then you can use that CBD. Okay, well, So here's what goes with that. If you're using an extract of a plant like this to get your CBD out or your hemp extract out, you're having to process so much more plant product because the yield of interesting and sought after cannabinoids and terpenes from something like a plant like this is much lower per plant than if you have a shorter, stubbier, more like a marijuana type plant, but that has been cultivated to have very low THC in it. So, what that means in terms of the toxicity aspect is that the more of this you have to process, the more potential there is for the contaminants that were coming out of the soil to be present in the end extract, depending on though how you process it. Are you going to do like a CO2 type of extraction? Are you just going to take one little chemical from here and there, or are you going to squish it and heat it and have an extract that has all kinds of stuff? Whatever was in that plant gets squished out of its little trichomes, and also the leaves, the roots, just everything. Just squish it, and then what's the toxicity going to be of that product? So that's where the differences in the plants originally can affect the output. So some of you may have heard me talk about this story of when cannabis was first coming on the scene, and this was like 2015, end of 2015, and while I was still at CSU, and while I was sort of delegated as the one to start looking at cannabis research for dogs, and went down to a Denver grow operation in a big warehouse to meet the owner, and who was saying that he wanted to support some research in dogs. So we looked at the grow operation and saw how very tenderly these little seedlings were cared for all the way up to where they were big. You go in a sequence of rooms, huge warehouse, ultimately beautiful plants, all this light. And the young 20 something person that escorted us through the building takes a wand attached to a black 50-gallon drum, no writing on it, anything, and proudly sprays all the little undersides of the leaves that are growing, and saying, "Yeah, you gotta kill the fungi, you gotta kill any little bugs that are in there." And it's like, okay, you're protecting your investment here, but what is in that? And now I see that you're drying it, and then for the consumer, the human consumer that might smoke it, um, smoking is a very active and efficient delivery mechanism for any of the toxins that are in that marijuana, which is what they were growing. So, is it organic or not? So these are all things that we have to think about when we're looking at um, cannabis and the quality. Here are the trichomes. So we'll just wrap up pretty soon. But then you extract, and this is actually odorless. THC and CBD have no odor. When you smell cannabis, characteristically, that's the terpenes and terpenoids. They are the essential oils, and they have intrinsic anti-inflammatory properties, which we won't go into today because we're almost out of time. But we have linalool, which is also present in lavender, which we've talked about before. So some overlapping effects there. We have limonene in some of the more strains that are more activating to the central nervous system, like in lemons. Myrcene, which is more physically relaxing, like we have in mango or hops. And then, of course, we're not going to do vaping, but there could be toxins in the home that animals are exposed to from vaping. And so we just can see how cultivation has been changing the ratios of active and interesting cannabinoids based on consumer interest. So with CBD with animals, that's where people want to talk about, what about dog biscuits? What about dog food? How can we formulate these? Well, my question is, how is it going to be stable in a bakery product like this? How is it going to be distributed? Is it going to be even? And the FDA has certainly found products that had no cannabidiol in certain dog treats. That was back in 2014, 2015, and they issued a cease and desist order. And so what we did at CSU is we started a study with Cannapet to find out from their clients what were they using it for, so that we could have a grassroots, so to speak, understanding of what consumers already were finding out for themselves, because there wasn't any published literature. So in order to drive a clinical study according to what had yielded the most interest, We looked at what people wanted, what were their findings. And so this was the report that we published, me and Lori Kogan and Pete Hellier, and found that from this anonymous survey of Canapet customers, there were 632. They had been to a vet, they had gotten it diagnosed, and the most common conditions in dogs they were using it for were seizures, cancer, anxiety, and arthritis. And now we have studies out of CSU and Cornell, CSU showing it benefited seizure patients, and then arthritis was shown to be helped in Cornell and CSU as well. Um, and just more information coming out on the pharmacokinetics and all that. So next time we'll be covering things about the endocannabinoid system, which CBD doesn't directly interact with, but THC does, and talk about the endogenous ligands and the distribution. So that just takes a whole hour to really talk about it. But the beauty of something like cannabis is that we're working with bioregulation and that neuroprotection, the anti-inflammatory effects, metabolic changes. But again, CB1 and CB2, which are your endogenous endocannabinoid receptors, that's not going to be directly affected by CBD, which actually has a very low affinity for those endocannabinoid receptors. But CBD can indirectly modulate the effects of THC as well as the endocannabinoids on these receptors. So the beauty of CBD is there are actually a number of other neurotransmitters, a long list, serotonergic and endogenous opioid systems, so that the multiplicity of these pathways helps to explain, the diversity of benefits that we're seeing many times with CBD, especially when it's presented in its entourage with terpenes and other interesting cannabinoids. So CBD and cannabis in general, because I do think ultimately we should be versatile in THC as well and get some tailored medications for our different types of patients. But it checks all these boxes: anti-inflammatory, neuroprotective, anti-nociceptive, anxiolytic, vasorelaxant, and antioxidant. So just again, wrapping up with, if you do your PubMed.gov searches, you'll see this too: cannabidiol, antioxidant, neuroprotective, anti-nociceptive, anti-anxiety, vasorelaxant, so improving circulation. Again, antioxidant, but anti-cognitive demise there. So in conclusion, and thanks for hanging with me here and for joining me today, know how herbs work before you prescribe them. There's so much to learn. Know the interaction risks. You got your resources here. Check the ingredients on the products. Don't settle for proprietary products, because once you see what we want to know about cannabis, I would hope that you would ask, why isn't every herbal company doing this kind of diligence to tell me exactly what's in it? What are the active ingredients? Was there any, heavy metal inclusion in that? Are there any, microbes in there? Why is it that we're looking so closely with microscopes, almost, metaphorically, at cannabis, and yet we're saying, oh, Chinese herb, yeah, little strychnine, little aconite. Oh, master knows best. He doesn't have to tell me the amount of strychnine, aconite, or even defend why we're putting herbal strychnine in a formula for dogs with this disease. Anyway, it should really shift all that. I hope it does eventually. And so we monitor our patients regularly. We look at their liver enzymes at least every 6 months, maybe even 6 weeks after we start an herbal product. So I don't see any other questions, and it is kind of late. So I'm going to wrap this up. If you want to find out becoming about a certified botanical consultant as a veterinarian or vet tech, we have our botanical medicine courses at curacore.org/vet. And we also have a full course on cannabis, 20 hours, and then we have our in-person cannabis day. Botanical day. This year we'll go more into all these herbs for pain and inflammation that we talked about today. So feel free to email me if you want, narda@curacore.org, and I will make this recording available on our website, on the Wednesday webinars website, at our curacore.org/vet. All right, good to see you. Thanks for joining. Bye-bye.